Hi friends, welcome to classes by Lab Doctor. In today's class, let us discuss about the complications of having high triglyceride or how dangerous is having high triglyceride to our body. So you all know that triglycerides are a kind of fat or lipids that are stored in our body when we consume extra calories than what is required or than we are burning. Then these extra calories are stored in our body in the form of triglyceride. So triglyceride is a form of lipid which comes to use in our body when we are in need of energy. For example, it could be when you are starving, when you are in between the meals, you are exercising, you need energy. So stored energy comes to use, and that stored energy comes from this triglyceride. This triglyceride normally it should be less than 150 milligram per deciliter. Sometimes it is between 150 to 199. We call it like borderline high. Suppose if it is between 200 to 49, we say it is high, and if it is more than 500, we say it is very high triglyceride, and that is called as hypertriglyceridemia. So you know that this triglyceride, whenever it is high, it can cause various problems: your heart disease, pancreatitis, metabolic syndrome, type 2 diabetes. All these things can be caused by this increased triglycerides, and increased triglyceride can occur because of various reasons. You are eating enough and more food than what is required to your body, you are having a sedentary lifestyle, you are obese, you are not exercising, your BMI is high, you are having excess of alcohol, you are smoking, you are having kidney disease, you are having diabetes, you are on certain medications. All of this can lead to increased triglycerides. So how will we know that we have increased triglycerides? See, most of the time a person who is having increased triglyceride, he may not have any symptoms at all. Sometimes because of certain complications of this increased triglyceride, patient can have chest pain, patient can have shortness of breath, patient can deposit fatty deposits of this triglyceride around the eye or in the skin, etc. There could be numbness or weakness in the limbs because of this peripheral arterial diseases caused by this triglyceride. There can be an heart attack, there can be a stroke, and then only when we investigate we might come to know there is increased triglyceride. So now, as you all know, that the main thing which happens when there is increased triglyceride is it always we associate it with increased cardiac risk, because this is the one which goes and blocks the vessels. It causes this atherosclerosis, which we have dealt in detail, and the blockage of these vessels will lead to insufficient blood supply to the heart muscles, and that is when it causes this chest pain, heart attack, etc. So high triglyceride, especially when it is combined with low good cholesterol, increased amount of bad cholesterol, increased amount of total cholesterol, etc., it adds on to the risk of developing this heart disease. So this is the atherosclerosis is a normal artery, and here you can see the atherosclerotic plaque. The triglycerides have come up here and they have almost blocking the blood flow. So this is a healthy vessel. You can see a fatty streak here, and this is the plaque which is formed here, and this is a complicated plaque which can rupture or it can also form a thrombus. So this is one of the complications of increased triglyceride, that is blockage or atherosclerosis. So this can lead to chest pain, heart attack, etc. So the another complication of this increased triglyceride would be the involving the blood vessels of the brain. So when the blood vessels of the brain are involved, the blood supply to the brain is compromised. So patient can have transient ischemic attack, patient can have stroke, paralysis, weakness, etc. So patient can have ischemic stroke, that is it can increase the risk of ischemic stroke when a blood clot blocks the artery and there is ischemia. So sometimes high triglyceride can be can cause even the hemorrhagic type of stroke or a cerebral infarction also. So there is increased risk of a recurrent stroke also when the person is having high triglyceride. So this also becomes important, that the the high triglyceride can be dangerous to the brain vessels also. So here you can see the paralysis, you can see the weakness, the shift of the mouth towards one side, and see here the blood vessels are blocked, causing blockage to the blood vessels of the brains, which are blocked and causing the weakness and all these symptoms. Peripheral vascular disease, I've told you that whenever the blood vessels in the limbs are involved, patient will have pain, there will be aching, there will be heaviness, there will be cramping when the patient is walking, climbing stairs, etc. That is called as intermittent claudication. Sometimes the toenail may stop growing, the hair, legs and arms might stop growing, one foot may feel colder than others. So all these are the symptoms of this peripheral vascular disease, which can occur because of increased triglycerides and they blocking the blood vessels of the limbs. So next complication would be acute pancreatitis. See, whenever there is an increased amount of triglyceride, very high triglyceridemia especially, then there is a significant risk of the patient developing this acute pancreatitis. So this is the structure of a triglyceride. It is made up of glycerol and fatty acid, and these are the lipases. This lipase from the pancreas, from the our gastrointestinal tract. So here you will see that these lipases are breaking it down, and they form this glycerol and fatty acid. It could be saturated, unsaturated, polyunsaturated fatty acids. So whenever there is increased or very high triglycerides, there it can cause acute pancreatitis because of various mechanisms. Two mechanisms are involved in causing acute pancreatitis. One is that it involves the calcium increase. So there is a mitochondrial damage, tissue injury. There are pro-inflammatory markers like cytokines, etc., which are released, and they cause the inflammation of this exocrine glands of the pancreas. And also there is this lipases which are secreted. They are the ones which cause the increased breakdown, and they are the ones which will stimulate this inflammatory process. And also because of hypertriglyceridemia, the blood itself might become viscous and causing the small blockages there. So here you will see that this is a normal pancreas, this is a liver, this is your gallbladder, and this is the pancreas. And here you will see that this increased triglyceride has damaged this pancreas because of the release of this pancreatic enzymes. There is increased amount of this lipase which is released from here, and because there is increased TG, to break down that there is increased TG. To break down the increased TG, there is increased lipase, and this corrosive inflammatory action of this lipase will cause damage and inflammation of this pancreas and the surrounding tissue, and that it causes pancreatitis. Here you can see the pancreatic acini, and here you can see the lipases which are released whenever there is increased triglyceride to break it down, and that lipases which are released can cause increased amount of inflammation. The corrosive action of this can damage the pancreas. So these unsaturated fatty acids which are released, they can also have systemic effects, and also they can have the effect on the pancreas. Like whenever there is this increased triglyceride, there can be increased calcium concentration in the acinar cells of this pancreas. There is mitochondrial changes which occur, tissue necrosis, cytokines are released, ductal function is impaired. All this can lead to pancreatitis whenever there is increased triglyceride. And also because there is increased breakdown of this TG, this fatty acid can cause acute lung injury, acute kidney injury, even cardiovascular shock or failure, which can occur in case of this increased hypertriglyceridemia induced pancreatitis. So here you can see there is increased serum triglycerides. So serum triglycerides are carried by the chylomicrons. I've told you they are the main carriers of this TG. So whenever there is increased TG, chylomicrons, you will have increased free fatty acid. This free fatty acid will aggregate, and they will cause damage to the vascular endothelium. They can damage, cause ischemia. They can cause acidosis, necrosis, etc. I've told you they can also increase the plasma viscosity. They can cause capillary plugging, and that also can cause ischemia, necrosis, and acute pancreatitis. So next complication which can occur in case of increased triglyceride is this lipemia retinalis. So here you can see this blood vessel, and see the blood vessels, it is become very pale. So this happens when the abnormally triglyceride levels are high. So here you can see the creamy white or salmon pink color discoloration of this retinal arteries, and whenever in mild cases the discoloration typically begins in the peripheral vessels, and as the condition progresses it can involve the central retinal vessels also. So here you can see the serum of this patient. Here this is normal color. Here you see the color, it has become milky white. This is because of very high triglyceride. So this is a normal retina. You can see the vessels, how beautiful and how pinkish they are, and here you can see this pale white blood vessels because of increased triglyceride level in the serum. So now next would be the xanthomas, which can occur whenever the triglyceride levels are high. So xanthomas are nothing but they are localized fat deposits. You can see here these fats have deposited here, usually beneath the skin, underneath the skin or the tendons they can occur. So there are different types of xanthomas. Like you have eruptive xanthoma. Sudden appearance of this xanthomas comes like, like some rashes or bumps on your skin. They will be filled with this TG cholesterol. Then you have tendinous xanthoma. Wherever there are tendons, like on the knuckles, near the elbows, buttocks, you have tendinous xanthoma. Then you have verrucous xanthomas. Usually, inside the lining of your mouth or sometimes on your genitalia you get. Then you have planar xanthomas. So that will be that can also come in high triglyceride levels. Then you have xanthelasma. Xanthelasma is, it is a yellowish bumps which you see around the corners of your eyes, close to your nose. So here it is usually common in the upper eyelid. Yes, you can get it in the lower eyelid also, and it can affect both. This is called as xanthelasma, and these are eruptive xanthoma. So this commonest site of this would be your buttocks, and here you will see these lesions are papular and they have this erythematous base. They have a itchy also, so that is why you will see this base is erythematous here. And sometimes patient get this something called as levido reticularis in the skin. So this is a skin condition where you have a net or a mottled pattern. So you can see this reddish bluish color discoloration you can see here on the leg, and this is because of the disturbance in the blood flow to the skin and reduce oxygen. That is why you get this discoloration here. Because elevated triglyceride they can cause this kind of a blockage, and they can lead to this kind of levido reticularis or this kind of a pigmentation. It is not only in increased triglycerides what you see this levido reticularis. You can also see this, when you are exposed to cold exposure usually triggers this kind of condition, that is levido reticularis. Sometimes autoimmune disease you will see, vasculitis you will see, anemia, certain infections can also cause this, certain medications can also cause this levido reticularis. I have told you another important component of this metabolic syndrome was your hypertriglyceridemia. And whenever there is hypertriglyceridemia, patients usually will have this kind of deposition of the fat around the belly, this apple shaped distribution of fat. Patient has hypertension, he will have heart disease, dementia, non-alcoholic fatty liver disease, insulin resistance, diabetes, lipid problems. He will have the patient can also have a PCOS in females. So these things can also come whenever there are increased triglycerides. So there is a risk of developing this metabolic syndrome. So you can see this kind of fat deposition. Mostly it is deposited in the visceral area or the belly area. So that this is called fat deposition in the form of an apple, and so that is one thing which can occur, that is the metabolic syndrome. Next would be your triglyceride causing diabetes also, because triglyceride by themselves they can cause insulin resistance. So it can whenever it causes insulin resistance, there is a difficulty for the body to process the energy efficiently, and because of which the lipid as well as the sugar levels get altered in the body. And insulin resistance occurs when your body cells don't respond to insulin properly. it is this hormone, this insulin is the one which will inhibit lipolysis. It will maintain the lipid as well as your sugar balance in the body, and whenever there is increased triglycerides, this can alter this kind of a metabolism. And inversely also, you should note that whenever a patient is having diabetes unmanaged, is not controlled, that can also cause increased triglycerides, because the body is not able to utilize insulin properly in diabetes. Fat metabolism gets affected, disrupted, and that can cause increased TG. So elevated triglyceride levels, especially when it is combined with other factors like there is blood pressure, there is low HDL, all this can contribute to developing type 2 diabetes also. So hypertriglyceridemia sometimes signs that the patient could have an impaired insulin sensitivity. So this can also be one of the complication of increased triglycerides. This could be few of the dangers of increased triglyceride level in your body. Thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.